Welcome back. The next company that we'll be presenting is Gabather with its CEO, Michael Robin-Witt. Yes, Michael, go ahead.
Okay, thank you very much. Well, welcome everybody. Thank you for spending some time looking at Gabather. Just give a general presentation of Gabather, what we do, what our philosophy is, and where we're standing with Gabather in the development right now. Gabather has the mission to develop next generation therapies against mental disorders. So we work with ligands for the GABA-A receptor in particular, and we're developing new therapies for mental disorders. So if I could have the next slide. And our main focus of the project that we are running on now, which is a compound called GT002, which I'm getting back later on, is looking at the effects of cognition in mental disorders. And cognition is basically includes memory and learning. And a deficit in cognition is a key factor in all mental disorders. And cognition is the way that we experience the world, as you see in the slide, outside of us, together with emotion and reason and the reaction to the world outside of us that is impaired in many psychiatric disorders. And I will get back to that, but it's actually a key factor. So it's a way of recognizing the world and reacting to the world around us, of course. So it's very, very important. So we can go to the next slide. So you see all these different diseases, be it depression, schizophrenia, autism, bipolar disorders, OCD, and so on. They all involved altered cognitions. They all involved actually deficits in cognition to more or less high degree. So in schizophrenia, for example, you have very severe effects on cognition that you really are not able to interpret, to understand the world anymore, and to react towards it in depression. But also remember that cognition is also impaired even not in pathological states, but in healthy aging. I mean, everybody knows that the older you get, the more forgetful you get. Some that can't remember this, can't remember that. And so cognition is an absolute key element of mental health and mental health functioning. And mental disorders are much more common than is generally known. And then the number we've put down here at 320 million patients globally is the absolutely lowest. If you think of yourself, there's always, even in the people that you know around yourself, you will see that there's somebody that had a mental health issue in one form or another. And I usually ask people when I have a presentation, well, how many people do you know that have died of car accidents in a country in a year? And everybody knows the number more or less exactly. But if you then ask them, well, how many people have died from mental health issue-related disorders, such as depression, nobody really knows. So the abstract figure, the number that nobody really knows, is much higher than 320 million worldwide for sure. And it also affects lots of young people, much more than one thinks. And it also affects people now with the COVID pandemic, which is becoming also not only a physical issue or immunological issue, but also a mental health issue. So we can go to the next slide. And this is what I'm trying to see. In this slide, I've put up a number of diseases, and I've highlighted cognition or deficits in cognition in the different diseases. And of course, everybody knows that if you have a disease like Alzheimer's dementia, then cognition is severely impaired. But even if you have a disease like depression, you still have problems with cognition. In schizophrenia, it's very prominent. So it goes through all the range of psychiatric disorders which we are addressing with our compounds targeting the GABA-A receptor. And in the later slides, I will show that the GABA-A receptor is such a key component of the balance between inhibition and excitation in the brain, that you can postulate that the GABA-A receptor is involved in all these diseases, either as a cause or as an effect. So it's absolutely key, and that's why it's a very, very interesting drug target that we're working with. And if we can go to the next slide. The story of Gabather is also, we're joining this arena because the current therapies for psychiatric disorders in general there's a lot of room for improvement. There's one of the key things is, for example, it takes a long time for example, antidepressants to take effect. Can be a matter of weeks. There can be actually no real, true positive effect in the sense that you're treating cognition. Antipsychotics, for example, in general, they dampen the so-called positive effects, so that people are just calmed down, but not really improved. And the targeting is very, let's say, very general. So you have drugs that target many different targets in the brain at the same time. And the difference for GT002 is that it's a very specific, a very targeted compound in the brain, because all the preclinical tests we've done on our compounds, they're very selective and they're very potent to the GABA-A receptor, i.e. we expect to have much less side effects and high specificity of the effect. I think that we've also seen in the clinical trials that we have done with GT002, both in phase 1A and 1B. So if we go to the next slide. And this was what I was referring to, was the balance in the brain between excitation and inhibition. So if you think of the analogy of a car, then gamma aminobutyric acid, would be the brake inside the car, and glutamate would be the accelerator. And the general thinking right now is that it's the balance between these two major neurotransmitters in the brain that is in deficit in different diseases of the brain. And definitely GABA is the main inhibitory, i.e. the brake mechanism in the brain, which dampens down activity. So if you think of disorders like epilepsy, for example, which would be one extreme, where definitely GABA is involved because there's a lack of inhibition and you have a general effect on the brain. And of course, the excitatory effect on the brain is done by glutamate and glutamate receptors. This is not to say that there are other extremely important neurotransmitters like dopamine or serotonin, which manage the expression of emotions and feedback of the brain. But these two neurotransmitters are the GABA and glutamate, and we are working on a drug development of ligands for the GABA-A receptor, which we think has a lot of promise, I think. So we can have the next. So this goes back to the slide that we had seen previously. So what we do with selecting very precise GABA-A receptor modulators is that we enhance the activity of inhibitory nerve cells and actually of a subgroup of inhibitory nerve cells, very specific regionally. And we leave, of course, then the cognitive symptoms in the preclinical assays that we've run. Again, the way we see the world is a combination of emotion and cognition, emotion and reason, to which we react to the world. So can I have the next slide? And this is where GT002 actually reestablishes the balance, we believe, between the experience and the reaction towards the world, i.e. that we have a resetting, an improvement of the cognition, an improvement of memory, an improvement of learning, an improvement of awareness actually, and attention in the human brain. This is what we're working towards. So if we can go to the next slide. Then the question is, there's a large medical need, of course. If you just think of a world that is getting older and older, and diseases like Alzheimer's, dementia are increasing, of course. There are competing pharmaceutical candidate drugs that are working with us, but the number of deals that are on the right-hand side of the slide, just to give you an example, is either Boehringer Ingelheim deals for 650 million, the Sage deals with 650 plus million, and of course 1.5 million deals, 1.5 billion, deals with Biogen. Just shows you that the market is huge and the unmet medical need is absolutely enormous. Of course, CNS drug discovery is a very risky business. I shouldn't put that, too far away out of your awareness. But if you succeed, the market is absolutely huge, and the market for deals is very, very big. So what we want to do is to get into this market by licensing out our lead compound GT002 into clinical phase 1b/2, i.e. we want to work either with a successful 1b clinical trial or a proof of concept trial in patients at the end of this year or the beginning of next year. So we can have the next slide. Yeah, this is a nice example, 1.5 billion. And this is very interesting because this Biogen Sage Therapeutics agreement is actually a compound that targets exactly the same receptor as us, GABA-A. And it was used originally for the treatment of postpartum depression. But it had some problems in the phase 3 trials. And still it was interesting enough for Biogen to acquire the rights from Sage Therapeutics in, I think it was the beginning of this year. So this is the kind of market we're looking at, the kind of partners, the kind of licensing we are aiming at. If you can have the next slide. So clinical development of GT002. I think we have promising preclinical studies. I have some examples on the right-hand corner of the slide. Sometimes people ask me, well, how do you know that the compound actually improves memory? And there's an assay called Novel Object Recognition Assay, a screen. And what you do is very interesting, actually. What you use here is a natural curiosity of a rodent, in this case of a rat. You put two objects to the rat, and at the beginning it will study both objects with the same kind of attention because both of them are new. Then after a while, depending how long you want to wait, say 24 hours, you put in a new object in. And if you have improved the cognition, the memory of this rodent, then it will, of course, have much more time, much more interested in observing the new object as compared to the one it already knew, which is the green one in this one here. So this can measure it. It's a standard assay. It's quite objective, actually, and it's a very nice test because you're using the natural behavior of a rodent. So important also that we have a clinical phase 1 program, and we've developed and actually patented a once daily oral formulation, which I think is very interesting compared, for example, the competitors. We have a very good capsule formulation. And so we're going into the phase 1b proof of concept study to see treatment activity. We have actually 2 patent families, so it's not only GT002, but our plan is to out-license GT002 and then reinvest the revenues that we get with such an agreement into our pipeline projects that we have running here in our labs in Södertälje. So we have actually research activities and the old AstraZeneca activities here in Sweden. With a very good IP coverage of GT002 and the pattern group. So we have not only have we formulated a composition of matter patent, but we also do have a synthesis patent because we made some progress in doing the synthesis of the clinical material. And we also have on our way to a medical use patent, which will cover GT002 for a lot of different indications, which will be very interesting. So if we can have the next slide. We've done 2 double-blinded placebo-controlled studies. We've done both a single ascending dose and we've also done a multiple ascending dose study. We've seen very good tolerability and we've seen a very good safety. We haven't had any adverse effects in the healthy volunteers that participate in the study. And this looks actually very good for a single dose daily treatment in patients in the future. So the bioavailability of the drug is very good and the pharmacodynamic profile is also looking very good. And I'll show you in the next slide what we want to do in our next trial. So if I could have the next slide. So what we're going to do now is a study that looks at the EEG effects, also electroencephalogram. So what we want to look here is what is the effect of our lead compound GT002 on the electrical activity in the brain. This would then prove that we got a good, in humans, blood-brain barrier crossover, and it's the absolute stepping stone to phase two studies. And it's actually a milestone because once we have proven that, then we can go and access partners also for studies or indications or clinical trial designs that they are interested in. So that's why we think it's a very important milestone to initiate partnership negotiations. And it's actually we've done at the request of many of the partner negotiations that we have had lately. So, and we hope to see such nice effects as we have on the slide here on the right-hand side. But we'll see, we're very positive. Another thing I can comment to this slide is, of course, we want to differentiate our compound against all the other compounds that are already on the market because there are lots of drugs, clinically used drugs, targeting the GABA-A receptor. So we also want to see that we're different to the ones that were on the market. And from the preclinical studies, we already know that one major difference is that our compound does not show any sedation in any clinic, neither in humans nor in preclinical studies. So that's very, very good because that's a key component of many of benzodiazepine-like compounds that are already on the market. So we can go to the next slide. So the clinical strategy for GT002 is we want to show with this EEG fMRI study where in the brain this compound is active, how it is active, and then we can go out and license the compound and for a number of indications which could be very relevant for GABA-A receptor ligand. It can be anything from cognitive impairment, depressive disorders, schizophrenia, autism, bipolar disorders, and substance abuse. So what we can do then is then go and approach potential partners, say, this is the effect of GT002 in healthy volunteers. What do you think you could use this for an indication? So we can actually use the compound for the pipeline of potential partners, and our partners will be basically the in-licensing departments of medium or large-size pharma. So we can go to the next slide. So it's a little bit of the track record, what we have done. So right now, if I go to the very end of this line, so we're doing the preparation. Oh, can you go one slide back? So we're doing the preparation of the phase 1b proof of concept study in human in healthy volunteers. And as soon as we can, towards the end of this year or next year, go do a proof of concept study in patients in our own study. But we're already now preparing, of course, and working on partnering to big and medium-sized pharma. So if we can go to the next slide. So we've pushed GT002 very hard towards phase 1B. Our idea is to get a partner before phase 2 or during phase 2 and before phase 3 for sure. And then with a range of indications that can come out of the EEG trial. And also on the slide, you can see that, of course, we have a couple of compounds that look very interesting that in our pipeline, where we're on the way to candidate drug selection and in preclinical trials in-house, but also we're doing a number of mode of action studies for GT002 on a preclinical level still. But the key thing here is that you have the partnering agreement or the licensing agreement somewhere between phase 1B and towards phase 2. And I think that is actually the last slide that I have. I don't know if I can go one ahead. So this is just the last slide to which I leave it with you. The growing base, I think it's very relevant. Aging population worldwide, COVID on top of everything, mental disorders will be in focus for many years to come. Available treatments some are good, but certainly you can improve a lot of them. That's what we aim to do. We want to improve those current treatments. We do have a library of compounds. We have a proprietary model, so we know how to synthesize more candidates if we wish to do so. Our lead candidate, which we've pushed for the last couple of years, is progressing into phase 2 clinical trials, and we're currently quite actively looking for partnering for late-stage development and commercialization. We're very open about this. It can be a joint development, can be out-licensing altogether, so that we'll see, and we're definitely looking for partners to help us in this part of the process. And I think that is the last slide too.
Då tackar vi dig Michael för den presentationen och nu blir det dags för Q&A som blir på svenska. Första frågan då. Vilka ser du som de viktigaste milstolparna för Gabather under 2021 samt vilka mål har ni?
Det viktigaste mål är att genomföra ett EG FMI-studie under 2021. Det är det absolut viktigaste. Och så förbereda för proof of concept-studier i patienter. Jag tror det är 2 mål.
Intressant. Och nästa fråga då. Skulle du säga att det finns några möjligheter att utöka antalet målindikatorer för er kandidat GT002 till fler utöver antipsykotisk läkemedel?
Jo, absolut. Men det är därför jag tycker att EEG-studien är så viktigt, för det öppnar liksom dörren för andra indikationer som kan vara också intressant. Som jag sagt under presentation är GABA den absolut viktigaste inhibitorn som neurotransmitter i hjärnan. Så om vi har en substans som modulerar din receptorsystem så har du möjlighet för många indikationer. Det behöver inte vara schizofreni eller depression, det kan vara något helt annat. Någonting vi inte tittat alls på är till exempel är smärta, som är en viktig indikation för GABA-modulatorer. Så potentialen är väldigt stor för modulatorer GABA.
Intressant. Och en sista fråga då. Hur länge kommer kassan att räcka om er option TO3 tecknas till 100%? Samt hur ska ni använda resurserna framåt?
Jo, men vi har budgeterat för alla de studier som jag pratade om, och kassan räcker i alla fall till exempel till proof of concept-studier också. Det beror allt på hur stor din ambition är. Kör du studier med många 100 patienter så har du självklart svårt att finansiera det. Men kan du göra studier med mindre antal patienter, mycket mer fokuserat på en intressant outpoints, så har vi inget problem i 2021, början till 2022.
Stort tack för att du var med, Michael, idag och lycka till i framtiden.
Okej, jag tackar.
Och vi är tillbaka i vanlig ordning om några minuter, men först en liten kort paus.